and also our only surgeon here for our conference, Dr. Cedric Ortiguera. He is a consultant and educating coordinator at Mayo Clinic, Florida. He did his training at Mayo Clinic, Rochester, an orthopedic residency, and then did a fellowship at Minneapolis Sports Medicine Center in sports medicine and arthroscopy. He is one of our leaders in using cutting-edge technology and initiated our robotic-assisted joint program at Mayo Clinic. Takes care of athletes of all ages. He is our go-to guy when we actually diagnose some of these sports med injuries we've been talking about. Dr. Ortiguera.
All right, good morning. I'm going to talk to you today about what sort of orthopedic conditions that we are hopeful that you as primary care clinicians don't want to miss, things that you should be referring to orthopedics, things that we know that are fairly common, and some things that are not so uncommon. I have no disclosures. So the first thing I want to do is give you some tips to hopefully not miss some of these diagnoses. We're going to talk about some common, uncommons, things that you frequently see, and they're not so bad if you miss them. But we're also going to talk about some of those zebras, things that you really should not miss, because if you do miss them, it actually can be quite devastating. And we'll point out a few different types of cases, things that you should be referring to us, because we might want to consider urgent surgical intervention for it. Now, just as disclosure, my expertise is primarily in shoulder and knee surgery and sports medicine, so I'll try not to stray too far out of my expertise. So if I can give you one slide and 3 tips to take home, it's this simple. Okay, if you don't want to miss things, number 1, take a good history. Okay, number 2, actually examine the patient. And number 3, based on those first 2 things, get the right tests. So I'm also responsible for orthopedic education. I have residents that work with me every day. I see diagnoses missed every day, whether it's the orthopedic resident, whether it's the mid-level that works with me, whether it's the medical student. And it always boils down to not taking the right history, not asking the right questions, and maybe not even examining the patient properly. So hopefully you weren't coming here looking for some specialty exam tips, because that's not what's going to help you miss or avoid missing diagnoses. It's really just talking to the patient and examining them. So sometimes you're fortunate enough, if you're covering a team, you're there, you see the trauma, so you don't necessarily need the history of what happened. But even if you're there, it's often helpful to ask them, where was your arm when you slid into second base? What happened to your leg when you twisted it? What did you feel? Now, it may not be a traumatic event, but there's other things about the history. They come in, they have 3 weeks of shoulder pain. Well, what actually is bothering them? How does it hurt? What activities are bothering them? Is it when they're serving, when they're playing tennis?